Hi, my name is Dawn Kantz, and I'm going to talk to you today about anesthesia coding. Anesthesia coding can be a challenge to students learning procedure coding for the first time. But if you can learn the difference between coding for an anesthesiologist, a CRNA, and a surgeon, then anesthesia coding will be a breeze. Anesthesia codes are found in the CPT code book under the anesthesia section in the range from 00100 to 01999. Examples of professionals who will submit claims for this range of codes are qualified anesthesiologist, usually a doctor of anesthesia or called an MDA, a certified registered nurse anesthetist or a CRNA who may be working or may not be working under the supervision of the anesthesiologist, and also an anesthesiologist assistant or an AA who may be working under the supervision of an anesthesiologist. Examples of anesthesia codes these providers would use are 00500 anesthesia for esophagus procedures, 00796 anesthesia for a liver transplant, and 001922 anesthesia for radiation therapy. Please note that these codes all fall in the anesthesia range of 00100 to 01999. Other providers who may administer anesthesia are doctors of medicine or MDs, for osteopathy, DOs, dentists, surgeons, or podiatrists who are qualified to administer anesthesia. However, if an MD decides to provide anesthesia services, the code will not be found in the anesthesia section. This is because an MD's anesthesia service is reported by adding a modifier 47, which is anesthesia by surgeon, to the procedure code for the procedure they performed on the patient. Some examples of these professionals who do not use anesthesia codes are an MD in personal attendance of a tonsillectomy surgery who would not use an anesthesia code. Also, an oral surgeon who personally administers a local anesthetic before an extraction would not use an anesthesia code. Some examples of procedure codes MDs would use if they performed anesthesia services would include 42820 with a modifier 47 for a tonsillectomy. Also, a 27269 modifier 47, open reduction of proximal femoral shaft fracture. Please note that both of these codes are surgery codes with a modifier 47 for anesthesia by surgeon. This is something totally different than what you would code for a regular anesthesia code. So what are anesthesia codes? They are codes 00100 to 01999 that are used only by anesthesiologists, CRNAs, and AAs. These are the professionals who only provide anesthesia services and do not perform any other procedures, such as a surgery for the patient. Surgeons and MDs, on the other hand, would not use anesthesia codes because they do more than only anesthesia services for a patient. They also conduct the surgeries and other procedures. So they would use a procedure code in the range of 10021 to 69979 with modifier 47 attached to those codes, if they provided anesthesia without the help of an anesthesiologist. Now answer the following questions about anesthesia coding. Would the anesthesia for leg, ankle, and foot code 01462 be used by a CRNA or a podiatrist? Would the surgery code for gastric bypass 43846-47 be used by an MD or an MDA? Who would use the code 00100? Who would use the code 32601 modifier 47? Now that we've broken down the anesthesia codes into the anesthesiologists and CRNAs and also into codes for the surgeon and MDs, hopefully it makes things easier to understand which code to use during which situation. Thank you and have a great day.